My name is Israel Abarca, and I'm a student here at Kaiser University, currently completing my bachelor's in interdisciplinary studies. Today, I will be discussing a topic that is very close and personal to me, the importance of leadership in my personal and working life. So tell me if this sounds familiar to you guys. Wow, you're so overstaffed, so if you guys are not working, you will be fired. Or, I'm gonna need you to come in 15 minutes early tomorrow, but I'm not paying you overtime because you enjoy working here, right? Or, can you believe how inefficient that person is? They will not make it very far in life. This and many other inappropriate comments are just some of the things my own boss will tell me and my fellow workers. Can you believe it? Her attitude towards us affected the way we felt about our work. It became a hassle rather than an enjoyment. And the sad fact is that this kind of authoritarian leadership exists in most hospitals, clinics, and offices that form the healthcare system. Not only are the healthcare workers the ones negatively affected by this, but the patients themselves are actually experiencing low quality of care. So, during my time here at Kaiser, I was able to understand just how important leadership is. But not just any type of leadership. I believe participated leadership needs to be implemented in today's healthcare organizations, as it increases patients' quality of care, it increases job satisfaction for workers, and it increases their ability to properly manage conflicts that are always present in the field. So we can all agree that the most important aspect of the healthcare system should be to make people feel better, right? But for most that go through the system, the opposite is actually true. Many people feel that their needs were not met or their conditions were not improved but just merely their symptoms. We can see how this type of disease-centered care increases the likelihood of chronic conditions such as hypertension and diabetes in the population. Many times the nurses, the frontline force of the healthcare system, can have a better picture of their patients' conditions. Their views, however, are sometimes not taken into account, as the doctors are the ones that believe that because of their position or their title, they know what's best for their patients. Participated leaders place emphasis on teamwork efficiency. Everyone has a say, and all points are discussed in order to achieve the optimal solution. This encourages patient-centered care, where doctors, nurses, and even patients work together to achieve the best care possible. Many organizations, such as the Plain Tree Alliance, are beginning to see a decrease in hospital stays, faster recovery rates, less readmission rates, and an increase in patient satisfaction for their care. Participating leadership not only helps patients, but it can also help the healthcare workers themselves. Healthcare organizations need to understand that the sum of the parts is always greater than the strength of the individuals. A participating leader encourages his followers to act ethically and morally, not because of the power that is given by their title, but because they lead by example. Participating leaders also encourage others to voice their opinions and have a bigger role in their careers. In other words, leaders encourage others to be leaders as well. Workers also feel that because their leaders care about their views, they believe they want what's best for them, increasing their influence power over them. Thus, if your leader is happy and motivated in their work, the same attitude is reflected on their workers. Finally, participating leadership can aid healthcare workers to successfully manage conflict. Now, conflict is something that is always present in all forms of organizations, but it is especially seen in the healthcare system. The main source of conflict usually comes from change, something that is always present also in the healthcare organization. Introductions to new technology, new and diverse workforce, and even new procedures and regulation are just some of the things that can introduce conflict in hospitals and offices. Conflicts are not always bad, but the way a leader manages these conflicts can negatively or positively affect their organizations. A participating leader can manage conflict by employing different strategies such as collaboration, competition, facilitating communication, and seeking consensus. How effective these skills are depends on how, when, and to whom they are applied to in times of conflict. And because participating leaders are closer to their workers, they can better understand what works best for them. So, in conclusion, we can see that participated leadership can increase patient quality of care, it can increase job satisfaction for workers, and it can increase their ability to manage conflict. As far as my boss, she no longer works there. Her position was taken over by somebody that is more passionate and practicing participating leadership, and me and my workers are definitely happier.